Hello, welcome to the Glow podcast. Today I am here with Dr. Tran, who is an expert in all things medical weight loss. And if you want to just go ahead and introduce yourself, that would be amazing so everyone knows who you are.
Yeah, well, thanks for having me. So, I'm Dr. Angela, owner of MedFit Medical Weight Loss since 2012, and one of the few still who are board certified in internal medicine and obesity medicine. But what do I really do? I, I help men and women who've been struggling for years, and you know who you are, with weight. No matter what diet and exercise you've done, you're losing the same 20, 30, 40, 50 pounds over and over and gaining it back to fix the metabolic mechanics that are underneath and create the real red carpet in a safe medical way to get you to your health goals without surgery. So let's have some fun. We've got lots to talk about.
Yes, no, that is amazing. And I love that you just dropped the word metabolic health there. I feel like that's kind of a big buzzword right now. So that's amazing. I'm super excited. So I guess the first question, who would an ideal candidate be for you for medical weight loss?
Yeah, well, first of all, literally, if you've been struggling for years, you're putting in the right diet and exercise, and for whatever reason, you're pulling teeth to just lose weight, you definitely need to address the mechanics. It's just like taking your car and looking under the hood. Okay, but number one, particularly as we get into the sort of like, the drama of the weight loss injections, right? It is, first of all, designed for those who are truly overweight and obese and those who have diabetes. But there are other individuals that don't meet that criteria, that don't realize that they are also good candidates. Okay, so the ones that I really love to help are particularly my females, also my males. I love my men because they just lose weight really quickly. But because I'm in the same category, I'm in my mid to late 40s, dealing with perimenopause, menopause issues, aging. It is not pretty being female and old, but I actually do eat healthy and exercise. But why do I feel like I'm swimming upstream to lose weight? So those who just really have been putting in the work for the diet and exercise but can't understand why they are having trouble with their weight, that is the absolute favorite category. The second category that people don't realize is that if you actually have a metabolic condition, but it is sideways to, weight management. So if you have a thyroid problem, or if you have, particularly females, a very special condition called polycystic ovarian syndrome or PCOS, dealing with that also causes weight issues. Or if you actually have a blood sugar problem, pre-diabetes. Gosh, diabetes runs in my family. Unfortunately, my mom didn't give me very good genes, and so these women are unfortunately almost are overlooked because they're going to their doctor and say, hey, let's fix your thyroid, but what about my weight? Like, oh, you need to go somewhere else. So I really want to speak to that audience as well, because I think people are finding that they don't know where to go for help,
Yeah.
and unfortunately they're going to places that are they're almost being dismissed. So those are some of the categories that you do not actually have to have diabetes or actually true obesity to understand that you are still a candidate for medical weight loss.
Yeah, no, and I mean, I can totally relate to that as a woman. Sometimes, like, you are doing all the right things. You're eating the correct foods, you're exercising regularly, and like you said, you're battling that uphill battle, and nothing's working, and you're just ending up frustrated. And I feel like another thing too, kind of going off of what you were saying, is do you have a lot of people that come to you and in unison with the medical weight loss injections, they're also doing some sort of like hormone therapy? Because that's a huge thing for women as well.
Yeah, absolutely. Like I said, the cool part about it is we're in 2025 and there's so much more an advancement compared to either just 10 or 15 years. So there's so much, quote, information out there. The only trick is that information is true to trust versus, unfortunately, we're running into social media where anybody can say anything. And you think that
Yeah.
it is true, but unfortunately, I've worked with a lot of women who have followed false advice for me to say, whoa, 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 we actually need to sort of reverse and fix things first. But the cool part about it is using, the medical knowledge that I have. But honestly, I think that it's the funny part, people actually don't come to me because I'm a doctor, even though, yes, that helps. A couple of reasons. Again, I'm in my late 40s. Most of my patients say, "Oh my gosh, thank goodness you're a female. You get it." As much as I love my men and very smart, but sometimes you can only logically understand perimenopause and menopause. You just never will really personally understand it, right?
Yeah.
I work full time. I have a family. And also, I have a 10-year-old daughter. I'm only 5'1" and I gained 40 pounds with her when I was pregnant. And I was also diagnosed with gestational diabetes and I had a thyroid problem. I mean, I always sort of kind of almost surprised when patients do, talk to me. They're like, oh my gosh, Dr. Tran, you actually get it. And that's really the power of helping patients feel safe talking to me because they don't feel judged anymore because, hey, guess what? I walk the walk and I've been through it on a personal level.
Yeah, no, that's amazing. I feel like coming to someone, like you said, you are a doctor, so of course you have knowledge in the area, but it's also you have a personal relationship with them too because you understand the struggles that they're going through on a very, very real level, which is really, really cool. So while people are on injections, is there any sort of lifestyle changes that they need to make? I feel like there's a lot of chatter, like you were saying, on social media and things like that, where you hear things that maybe aren't necessarily true. So I would love to hear from you what, if any, lifestyle changes your clients have to make.
Yeah, absolutely. I have a kind of one of my favorite sayings, success is actually a sequence. And so the reality is that yes, you can be successful, but if you actually do the steps in a certain priority, then you are more likely to reach your goal. So let's say, for example, again, yeah, if you've been struggling for years putting in the diet and exercise and you're not getting anywhere, we absolutely have to look at your blood work and look at you medically. So that's just one of the formal things of just understanding maybe you do have a thyroid problem that you didn't realize, or your blood sugars are too high. I really do a thorough look down that is a little bit more advanced than what a primary care doctor would order. Nothing fancy. I'm not into the 50,000 pages, of all these markers that you don't really need. But we have to understand where the kinks that you don't even have control over before that. So that's step number one. And then step number two, absolutely. I think people don't understand that, diet is such a broad term. Most of our audience already knows that it has nothing to do with calories in and calories out anymore. But the problem is that they come to me and say, well, should I have the keto diet or the intermittent fasting diet or the Whole30? And I'm like, no, you need to have the diet that you can follow.
Yes.
So it doesn't always have that cookie cutter approach, which we wish. But, yes, keto works, but what if you go on vacation? Or what if Aunt Martha died and you have to go to Atlanta and stay there for a week and visit family? There's just so many factors in that. So we really hone in on the basics of what truly is that lifestyle change question you ask is what does that look like for you? Are you a stay-at-home mom? Do you travel Monday through Thursday? Do you have to entertain clients? Are you showing houses? So we really work on that. And then the third piece, which is really missing that I really want to kind of push for people, yeah, we do medical weight loss, we do diet and exercise, we'll prescribe medications if you're a candidate. Hardly anybody is actually addressing, quote, the lifestyle itself. Are you stressed out? Do you have a boss that is demanding? Do you have a husband that travels for work and you're stuck being single mom for, a week? Are you waking up at 2 a.m. wondering if you're going to fall back to sleep. So I think that is something that we really need to kind of push into the forefront, that it's really not about the food and the exercise. It, for lack of a better phrase, yeah, what is your lifestyle? Let's revisit that and make it easier for you.
Yeah, no, I love that. I think that that's great having like a very holistic, integrative approach. And then also, I loved what you said about dieting too, and it being not like what's trending right now, but really what's sustainable for you long term based on your lifestyle, really. If you're traveling for work all the time, you're not going to be able to follow,
Right.
Whole 30 or whatever it is, because you're going to be eating out with your clients or, doing whatever. So it's like finding what really works for you. And then I also think too, everyone's bodies are so different that different diets, like some women need more red meat, or some women are good with a vegetarian diet, so I think it's so different for how your body interacts, and really focusing on what makes you feel good too.
Yes, yes, absolutely.
Yeah, no, I love that. So I guess we are coming into kind of summer season and bikini bodies, and everybody loves getting ready for summer. It's not sweater season anymore. We're getting into that time. So what are some practical science-based strategy for losing weight effectively and also sustainably healthy in a way that works for you before kind of going into summer?
Yeah, absolutely. Well, we all know that you all need to start now. We all know that summer bodies are made in the spring. So,
Yes.
don't wait until 6 weeks before that wedding. Although we've helped people, get to that finish line in a very short time frame, I don't recommend it. But the biggest thing that we want to focus on first is, rather than understanding or thinking about, okay, what should I cut out, Dr. Tran? Nope. What do you need to add more of? So let's get out of this deprivation. I need to starve myself. I need to cut calories. I can't eat dairy. I can't eat sugar, and I can't breathe. So, but the biggest mistake is this, that, okay, maybe I do need to add more sleep, or more protein, or more water. Those are some of the literally ABCs 101 basics. So think more, more, more. And all of you out there, you're raising your hand. Okay, I'm guilty, Dr. Tran. I don't sleep well, or you're right. I literally don't eat enough protein, kind of thing. So that's actually number one. Okay. Number two, yeah, it's getting warmer, here in Colorado. Oh my gosh, I'm just in love with this like 60 to 70-degree weather. I just want that hush hush snow to go away. Um, and I always tell patients, don't don't get fanatic about, like, okay, now I need to join the gym. I need to get on the treadmill 30 minutes, 5, 6, nope. Just get outside and walk. But not for the sake of like weight loss per se, but it's for like, let's just get sort of kind of that mentalness. Let's get back out in the sun. Let's be excited about the summer, but get your body moving. So that it just becomes more of a habit that, okay, I'm going to be more active and less sedentary, kind of thing. And then the third piece of the puzzle is, just, if you are going to exercise, this is for both men and women. If you're going to exercise, I'd actually prefer you to do weight resistance exercises, so weightlifting. I'd almost sort of like, just don't even bother with the treadmill, or in our world we call it the dread mill, right?
I love that.
Weights will go so far along. And then last but not least, the bonus is that, now that we are getting into, the summer warmer weather, it's sort of like, let's just cut out the negative noise. So just realize that, what are you feeding yourself other than food? So is it kind of the social media nonsense that maybe you don't need to be paying attention to? Are you scrolling mindlessly, type of thing? Are you eating? Are you actually working through your lunch instead of actually taking a break? When was the last time you actually were present with your family, versus then eating and hopping on the computer, so those are some of the things that we sift through, but believe it or not, don't overcomplicate it. But the bottom line is just that let's start thinking about how you can add more, and you'll realize that you'll go a lot longer way rather than cutting out things.
Yeah, no, I think that that's great because I do think a lot of the times when you get into kind of like a restrictive mindset, it becomes very like a negative around the things that you have to do to achieve the goal that you want. But when, like you were saying, when you get in more of that abundance mindset, it's more of a positive experience, like you're adding things to your life rather than taking them away. So I think that's a great approach. So you already talked a little bit about strength training, and I think strength training is super important as well. So what role does strength training play in achieving a lean, toned look kind of for your summer body?
Yeah, well, building muscle is probably one of the best, most effective ways to even just influence your metabolism. I think people kind of know, but they don't realize that with every decade that you age, you're just losing muscle. So, especially when you're in your 40s and 50s, like me, you literally can have the exact same lifestyle as your 20-year-old, but you're gaining 10 pounds while that 20-year-old, is just living freely.
Hmm.
Type of. So muscle is going to help you burn calories more efficiently. And particularly us females who don't necessarily have, the same mechanics as a man, it is really important to put weight resistance in the forefront. So,
Hmm.
and we're not talking about heavy. You don't necessarily have to go to the gym. I personally actually just have, set of dumbbells, and then I use a fitness app at home. So there's nothing fancy about it. I'll do anywhere from, 20 to 30 minutes a couple times a week. But it really just allows, obviously, the mechanical of, making sure your metabolism's in check. Best way to burn body fat, obviously get the tone and definition, and then taking out that misnomer that I think a lot of particularly females worry that I don't want to get bulky or whatnot. And
Yeah.
it would be really difficult to get bulky unless you were truly doing, hormones and things like that. So, I mean, in on honesty, we've always promoted strong will always beat skinny.
Yeah.
So we really want to redefine how society actually looks at health. And I am just excited to actually see other platforms really promote that as well.
Yeah, no, I love that. I think that's great. I guess right now, so a lot of people do like a lot of different exercises. We have so many boutique fitness studios, so many gyms, all of that stuff. Do you have, obviously, weightlifting? You love weightlifting, and I think that's great too. Do you have any other types of exercise that you would say, like, oh, this works really well for weight loss? Or is it more of like, as long as we're moving?
Yeah, yeah, no, that's a great question. Number one, first you have to kind of identify, are you someone who can exercise on your own, or do you really need that community?
Yeah,
I find that there tends to be a higher percentage of people. It's like, gosh, I just need to kind of get out there, maybe get some accountability and be part of a crew of others who get me. So that's actually what I would choose first. What's the personality of that studio, a community that you want? So, obviously they're all positive, but it just kind of depends on which sandbox do you want to hang out with. So
yeah.
that's actually what I recommend first, not the actual exercise itself, but, go to their social media. Do you vibe with them? Do they have the right message? Do they have the same values? That's actually the most important thing first. The second thing is that I actually do a variety of things. I used to run, not against runners, but I don't like it anymore. Just because I think I'm just old, and I had an ACL surgery, so just decided that it was not for me. Kickboxing is my thing. I know that it's not for everybody, but I hate to tell you, it's something therapeutic about punching and kicking a bag for 30 minutes. Is awesome,
I
not just
believe
from
it.
a standpoint. But one of my favorite exercise, again, is not for everybody, but it is so effective, is rowing. So rowing really targets, 85% of the muscle groups, and it's just one of the very few exercises that you can do, only just 20 minutes and get a full body workout. It's low impact. Even my mother can participate in it, and then even my 10-year-old daughter can participate in it. So it's kind of one of those things. But bottom line, it's really, I always tell people, and I get it. There are so many people who just say, Dr. Tran, I hate exercise. And I say, that's actually okay. You don't have to love exercise, but what if it's the joy of movement? And ask yourself, maybe the only reason why you don't like to exercise because it hurts and you can't breathe and you don't have energy. So it's not exercise itself. So let's work on losing weight and then revisit, wow, I actually kind of love this studio. And then it becomes actually enjoyable, committing to it thereafter.
Yeah, no, I love that. I work out quite a bit, and I always tell people whenever they ask me like, "Oh, like like why do you work out?" I do it like more at this point for like my mental health. Of course, it's for
Mhm.
physical health too, and the community, all of those things that you were talking about. I feel like it's more than just like, oh, I want to do it for my physical health. Of course, that is a large piece of it, but there's other pieces too where you get a lot of other benefits. So I love that you kind of brought that up. And then we'll get into, so what are, with medical weight loss, more of what are some of the biggest myths or misconceptions about weight loss injections that you frequently hear that you're like, oh, this is just not true, or you're like, oh, I wish, who said this?
Yeah, no doubt. Let's thank you for asking that. Let's just get it all out. This is the one thing that you need to listen from this podcast of anything else. Weight loss injections are not a form of cheating. Please get that out of your head. So it would be like saying women who do fertility because they can't get pregnant themselves is a form of cheating. It's the best analogy. So please understand that, you know, there are people who have struggled for years and you have no idea, you know, the worry, the what keeps them up at nighttime. And so be it. If they need a weight loss injection that actually scientifically, legitimately has chemistry to fix something underneath. So that is, you know, really the first and most important thing. The only thing that I would consider as quote injections as a form of cheating, and unfortunately I see this and it's important to say out loud, the people who actually don't put in the work for the diet and exercise. They just say, oh, I took the injection and I lost weight and I'm just going to be on the injection forever so I can eat whatever I want and, live freely type of thing. That would be the form of cheating. But if you are legitimately someone who just has been stuck, been doing everything right on the outside, but the injections underneath can actually fix the inside, then it's a marriage made in heaven. Okay, so
Yeah.
that's number one. Number two, gosh, injections are not the bad guy. I love it, and I actually did a video. I'm a big fan of Real Housewives. You have to say, thank you for Real Housewives for putting these injections on the map. Maybe not in a great way, kind of a thing. So, but these injections really just treat an underlying disorder. And, we'll talk about that. The reason why these, quote, became famous, they're not skinny drugs. They actually treat insulin resistance. So that's the misconception number two is that, no, this is not just to make you skinny. It actually directly works on your insulin to help you metabolize sugar much more effectively because you potentially are stuck in storage. Okay, it also, yes, it suppresses your appetite because, hey, guess what, there are people who actually don't feel full, but it's actually not because of a willpower or weakness factor. It's a chemistry signal. So to fix that, is powerful in itself, and yes, it legitimately increases metabolism. So the misconception that these are skinny drugs, that's not true. And then just finally, number three, this is also important. These are prescription medications, just like all other prescription medications that are going to have side effects. Yes, there are a lot of side effects involved. That's why you need to work with a medical weight loss doctor. But hey, guess what? So does ibuprofen
Yeah.
and sugar and alcohol and the antidepressant that you're taking. They dramatize the side effects of the injections. Oh, it's going to mess up with your stomach. You're going to end up in the hospital. It's like TMZ for medical weight loss, the paparazzi on these injections. And I always say the main side effect concern that you need to worry about from the weight loss injections is, does the prescribing provider have experience to help you?
Yeah.
The most serious side effect of all. End of story. So please understand that, yeah, these have side effects. They're not vitamins, they're not easy, and they're complex. But the most important thing is to help you navigate, making sure you are with the right doctor. And the reality is you actually already experience the side effects of being overweight. And that's far worse than the short-lived side effects that these injections can even just potentially cause.
Yeah. No, I think that's a very fair point. I mean, everything kind of has a side effect to it. There's always a yin and a yang,
Yes.
and so I think that the way you describe that is perfect, especially like I am curious though with the underlying issues. You mentioned the insulin resistance. Is there anything else specific that these medications address?
This is perfect for your audience. So not just treating the insulin resistance, the appetite suppression, the weight loss, it reduces inflammation. So that's a stress on your body. And hey, guess what? Aging females, yeah, I want my skin to look, nice and hydrated. I don't want wrinkles. I don't want to look like I'm, 47, I still want to look young. But, there are now kind of like this whole anti-aging benefit of reducing inflammation,
Yeah.
obviously getting your health in order. When combined with diet and exercise, you realize, oh, wow, I'm finally putting things together, that that now women are like, okay, now I can do my skincare and all of these other things, and I'm part of the bunch. Anything to just make me feel good about myself, I'm all for it. And the cool part about it is that if you nurture the foundation, much like watering a plant, then all of your skincare routine will bloom. So this, like I said, there is so much more to it. The second thing that I think people really want to know, and this is also exciting and up and coming, is that, believe it or not, these injections not only work in the gut, but they also work in the brain. And now they're finding a side benefit that it reduces alcohol cravings. So as you know, I mean, we all socialize, especially now in the spring and summertime, and a glass of wine here and there and whatnot. But it's not, friendly to your belly fat, right?
Yeah.
So people just sort of like pleasantly surprised, like, wow, I don't even like crave alcohol. I almost could just almost not even like need anything, type of thing. So stay tuned. Is that there's actually going to be legitimate studies, showing the benefit of that. So these injections legit, are game changers. And here's the funny part. There's more in the pipeline. Ozempic literally is going to be old news before you know it, because these new kids keep coming out. So please respect the science behind it, because, we want to do our best. It's not picture perfect, but there's more to it than, quote, losing weight.
Yeah.
And it's exciting in my world on what it has the potential to do.
Yeah, no, that's amazing. Hearing definitely the about the inflammation, decreasing inflammation, I think that's great because I'm sure you've seen on social media, it's like those before and after pictures of like people with like kind of like their faces when they had inflammation and then post inflammation. So I feel like that's really, really cool. And then also hearing about the alcohol cravings,
Yes.
that is wild and could be like a whole nother drug in and of itself if they like, you know what I mean, just for people struggling with that too.
Yeah, and again, don't be surprised. It's going to be in the pipeline that there will be an FDA approval for utilizing these injections for treatment of alcohol addiction. So, there are definitely studies behind it. So stay tuned.
Yeah, wow, that's amazing. So right now, what are kind of, besides, we've already, I think this is a great segue into this question and we're already kind of talking about it, but with medical weight loss, what are kind of the current trends in this market right now and where are things headed with like the future for this besides what we kind of just discussed?
Exactly. Like I said, we already have one of the injections, Zepbound, has been FDA approved for even obstructive sleep apnea. Uh, that's kind of like a left curveball, type of thing. And then another weight loss injection, Wegovy, is FDA approved for the reduction of heart disease and cardiovascular risk. So again, I get it. These injections are at the dinner table, and people can say whatever opinions that they have, but there is science to show that it does a lot more than just helping people lose weight. So it's just exciting in itself. Like we talked about, like I said, I'm expecting probably next year or a year or two. Again, I'm waiting for that next new kid on the block injection who already has a nickname that literally is going to make Ozempic look like old news just because it just even that much better.
Yeah.
So it's literally providing people access to even more advanced treatment. Not that surgery will ever go away, but we're definitely helping people lose 100, over 150 pounds, or even 200 pounds without surgery these days,
Yeah.
which is awesome. And like I said, stay tuned on more studies about just the anti-aging properties and just how it's going to affect just how we are in this sort of society when it comes to food and exercise and youth and things like that. So welcome to my playground. That's what this looks like.
I love it though. It sounds like there's so many exciting things happening that like I mean it is so new, you know? And so I'm sure that there's been obviously it's been around longer than a lot of people know for
Yes.
sure. But it's so new, so like it's so exciting to see where this whole world goes and like with it helping other things too. We're going to see it all over probably,
Yep.
which is amazing. Um, so with all of these changes kind of happening in the market of medical weight loss and potentially other industries too in the medical field, is it making it more challenging or easier to kind of operate in this ever changing landscape for you?
You know, both. I mean,
Yeah.
I feel like I've been waiting all these years since I became a specialist in 2012. This is like my stage. I finally have something that is legitimate. I'm helping people left and right, and it's awesome. But it is noisy in the medical field all around. So there are doctors that promote it, and there are doctors that actually promote against it. Everybody has their own opinion. Then you fall a line with like nutritionists, personal trainers, and just regular people. Everybody has an opinion, and then that's why the audience is so confused who I listen to, type of thing. So I know that there is a great organization, the Obesity Medicine Association, where there are legitimate specialists like me that are really in the forefront to just bring factual information so that people can just understand what it's all about. But it's tough. And then you add the layer of insurance coverage, costs, access to it, how the government is involved and all that stuff. So it's been tricky. But the good news is that there's so much more, that's going on today compared to even 10 years ago. So, I mean, we're definitely a long ways away from just really understanding what this is all about. But for me, the main reason why I went into this was I feel like I'm a better doctor now because I'm treating kind of the root cause that, hey, guess what? If you are healthy, then yeah, you don't need to be on your blood pressure medication, or we take you off your cholesterol or reverse diabetes. And there is even a reduction in risk of cancer, like breast cancer, things like that. So I'm excited about what healthcare can do, but right now it's fuzzy.
Yeah, no, I feel like I mean, it's an ever changing field, like I said. So I'm sure it's difficult to kind of navigate all of those changes, and like you see new stuff published, every day where you're like, oh, okay, so this has changed now. Okay, so now we were here. So I can just imagine trying to keep up with everything and stay up to date is challenging for sure. And so one of my favorite questions to ask is kind of, because obviously I'm not in your position, I'm not a medical weight loss doctor, and most of the people in my audience probably aren't as well. What are you responsible for on a day-to-day basis, and kind of what does your day-to-day life look like? That's such a popular thing on social media now. They're doing, the vlogs of their day-to-day. So if you want to tell us, what that kind of day-to-day looks like for you.
Yeah, number one, safety. Hands down. I mean, yeah, there are a lot of people who are, getting sick, but it's just because they're, falling through the cracks and nobody is paying attention to them. So we have a dedicated care team, with every patient to just say, hey, are you doing okay? Or you do have side effects, and are you losing weight? Things like that. So I think that people forget that that's actually the most important part of the equation is like, oh yeah, I actually need to just make sure somebody's keeping an eye on me, kind of thing. Number two, I do spend a lot of my time really educating people on sort of the lifestyle piece that we talked about. Injections are injections, and they're really friendly reminder, only a small piece of the puzzle. But the real issues that we're talking about is, you know, people being judged. Well, first of all, they were judged for their weight. They're finally losing weight, but now they're being judged for using injections. And then congratulations, now you're skinny. You're being judged for being skinny. And
Yeah.
it's hard to navigate, and it's mental toll. It influences people's relationships, ideally in a good way, but if your partner or your best friend, your mother, your coworker is not on the same page, it can cause a lot of strain. So we work on that. And then the third piece is that this is kind of funny, but when you are at your healthy weight, you almost don't even recognize yourself. And these women particularly, it's like, who am I? And it almost feels so awkward. So we really get deep down into the topics of self-love, that you're worthy and deserving of being here. And then we really get into sort of kind of the past traumas and things like that we're really good at kind of putting in a box and throwing away the key kind of thing. So those come to the surface, but in a good way. But we do have a gentle handling. So the reality is that you don't realize that weight really sometimes is not related to, like, the food and the exercise. It's just the emotions that you carry.
Yeah.
And but the good news is that you are ready to address it at this point. So that's really, what I spend majority of my day and then just hanging out on social media just to just make sure everybody knows the facts, right? Stop listening to
Yeah.
this person, and please, you know, get the facts straight.
Yeah, no, I totally get that. I love what you were saying too. I feel like from talking to you now for, a little while, I've kind of understood a little bit more of your approach, and I just love how holistic it is. You're not just looking at the physical, but you're addressing the mental, the past traumas, the new versions of themselves that they're bringing to the world, their relationships, and like how everyone's interacting with them now. So like I love that, because I think that that's really really important, to have that health in all aspects of your life, along with of course your physical health is so important, but addressing everything too with that. So I guess right now with your business, do you have any goals right now? Say for like, I know we were talking about medical advancements as well. So for your business in general and kind of like where you want your business to head, do you have any goals that you're focused on for the next 6 months, 12 months, 24 months, or however far you're looking into the future?
Yeah, absolutely. Again, I mentioned this before. The biggest gap is that injections are fun and games, but nobody is really addressing the real issues when it comes to kind of the mindset. We talked about sort of the lack of self-love and behavioral changes. So I really want to sort of create, that mass community. At the end of the day, my patients just want to feel heard, and I hear you today. And it doesn't matter what that number on that scale says. We're here to love our bodies, but it doesn't mean you get a pass to neglect it. And if you just understood that loving yourself again is actually the very first step before you even figure out what you should be changing your food habits, then the body listens. So I'm just excited to really launch more education, more online courses and community based to, really push for body positivity. But at the same time, we got to love ourselves and we got to take care of ourselves. But the cool part is that because we take care of ourselves, that makes us better at taking care of others. So just don't take yourself off the list. That's my parting words, is we can take care of everybody else like we always do, but don't leave yourself out.
Yeah, no, I love that. I feel like I one of my favorite sayings from somebody that I follow is you have to be selfish first sometimes to be selfless. And I feel like that really applies to like kind of what you were saying, and being selfish. Obviously, it sounds bad. It has a bad connotation, but it's more of just loving yourself first, kind of like you said, rather than actually like being selfish. So, right now, with that kind of in mind, what matters more to you right now with your business, with your clients, with everything kind of going on? What matters the most to you, and why?
And again, I mean, yes, we're all talking about the injections. We want it. We know people who are on it and all that stuff. Probably the most important thing is that just be in the safe hands to take care of you. Unfortunately, you can get it almost anywhere. It's a little bit scary thought. And I think, again, reminder, yeah, the injections work, but not going to work if there's nobody watching you and you're causing more harm, or you're losing weight and not necessarily the right way and whatnot. So safety, number one. Number two, just again, education. I always just tell patients, well, the reason why these fad diets didn't work is because you're just following a blueprint, but you don't even understand how your body works. So it's just
Yeah.
all about education, and just really understanding, oh, I have control now that I understand, what it looks like, when I'm 30 versus 40 versus 50, type of thing. And then, the third piece is just being healthy is beyond the physicalness of it. So when you truly understand that it is tied to how you love yourself, how you take care of yourself, then yeah, you are going to sleep better. You are going to have more energy, and you're going to be on top of your game in your career. But it's ignored if you ignore yourself. So those are some of the things that just really want to push beyond just the glamour, of what these injections are doing out on the internet.
Yeah, no, I love that. I think that that's great. Is there anything else that you want to tell everyone? Any other things that you kind of want to debunk or demyth, before we hop off? I definitely want you to give how people can find you too. I know you're on Instagram, LinkedIn, I'm sure you're on most social media and everything, but if there's any like final words you want to say.
Yeah, absolutely. Just two things. Number one, if you've had a weight problem for a long time, the chances are it's actually not your fault. So I think you just kind of recognize, especially as a female, we're stubborn. We're accomplished, we're perfectionists, we're overthinkers. But then they're like, gosh, what's wrong with me? Why can't I lose weight? And I'm like, hey, guess what? It's actually not your fault. So, fixing the mechanics might actually be the last piece of the puzzle. And then number two, let's really get the shame out of this whole arena. Don't feel ashamed for having a weight problem. Don't feel ashamed if you actually did decide to do an injection, and don't feel ashamed that you actually do want to be your high school weight again. You know, your body is your body, and you know what healthy is. And we want to sort of kind of just clean up the judgment around all of this. But the cool part is that, you know, today we've got a lot of things that work. You just have to work with the right people.
Yeah. No, I love that. I think that that's great. I really think there are a lot of things that people think and a lot of judgments that people put on, but it's kind of, it's, a lot of people don't know what they think they know too.
Yes, yes. Sure.
So thank you so much. I really, really appreciate this conversation. And I feel like we got to talk about a lot of things that will help a lot of people out there, a lot of women, a lot of men. So I think that that's super everything you said was super helpful.
Yeah, and again, they can just follow me on Instagram at medfitdrtran, or just hit up on our website. It's medfitmedicalweightloss.com. But let's hop on a conversation, private message me, but you have no idea how quickly your life can change, when you work with, the right formula.
Yeah, I love that. Well, thank you so much. And I really, really appreciate it. It was a great talk.
Yeah, thanks so much for having me.